Most behavioral health denials never had to happen, they were avoidable on the front end. The cold, hard truth is that most denials can be avoided by billing properly before the claim ever goes out. Some denials are unavoidable. Payers deny and delay as a tactic. But the ones you control are the ones worth fixing first. In this guide, why claims get denied, how to appeal the ones you can, and how to stop them from happening in the first place. So, why do behavioral health claims get denied? Denying claims is one tactic payers use to delay payment, sometimes by mistake, sometimes by randomly denying or requesting extra records. There is no real industry standard for behavioral billing, so what works for one payer may not work for another. It is a nationwide problem. 60 Minutes even ran a segment called Denied. Get the front end wrong, and the cost is real. Some mistakes end the claim permanently. Every payer has a filing window, anywhere from 90 days to a year. Miss it, and you lose the right to bill entirely. There is no appeal for a timely filing denial. The revenue is simply gone. This is where the right platform helps. A dedicated RCM platform is designed to automate denial tracking and surface patterns before they become systemic. Instead of chasing claims one at a time, denial tracking is designed to flag what's repeating. Patterns surface early by payer, reason, and service type, so you fix the process, not just one claim. Understanding why claims get denied is the first step to preventing them. Here are the 5 most frequent culprits. Let's walk through all 5. 1. Missing pre-authorization. Many payers require prior authorization before a patient begins treatment. Skip this step and the claim is dead on arrival, especially with residential and PHP levels of care. 2. Insufficient clinical documentation. Payers want proof that treatment is medically necessary. If your notes don't clearly support the level of care billed, expect a denial. Vague progress notes are red flags for reviewers. 3. Coding errors. Using the wrong CPT code, revenue code, or modifier is one of the most preventable denial reasons. Behavioral health uses specific code combinations. A single digit off can trigger an automatic denial. 4. Timely filing misses. Every payer has a window, and missing it is final. These deadlines range from 90 days to a year, depending on the payer. Miss it, and you lose the right to bill entirely. There is no appeal for a timely filing denial. 5. Non-covered services. Not every service is covered under every plan. Some exclude certain therapy modalities or limit covered days. Verifying benefits before admission is the only way to catch these before they become write-offs. A denial is not always the final word. Most denied claims can be recovered through a structured appeal in 3 moves. Most denied claims can be appealed and overturned. 1. Review the denial reason code. Every denial comes with a reason code on the explanation of benefits or electronic remittance advice. Read it carefully. The code tells you exactly what the payer objected to and determines your appeal strategy. 2. Gather supporting documentation, then write your case. Pull together clinical assessments, treatment plans, progress notes, and prior authorization records. Then write a clinical appeal letter that addresses the denial reason, referencing diagnosis, medical necessity, and criteria like ASAM or interqual. 3. Submit within deadlines and escalate if needed. Deadlines are strict. Most payers give you 30 to 180 days from the denial date. If the internal appeal is denied, you typically have the right to an external review by an independent third party under CMS guidelines. The best denial strategy is preventing them. Build these practices into your daily operations. Verify benefits before every admission. It takes 15 minutes and can save you thousands. Use a clean claims checklist. A clean claim has 0 errors on first submission. Document medical necessity clearly. A purpose-built EHR with structured templates is designed to connect each note to the care provided. And track denial patterns with monthly reports. Patterns reveal the root cause, not just the claim. Stop letting avoidable denials drain your revenue. See denial tracking and prevention built into one platform at behavehealth.com. Book a demo and see how denial tracking and clean claim tools fit your workflow at behavehealth.com.